Like every critical care health professional, I've had many occasions where I've struggled to bag mask ventilate a patient because they have a beard. I've developed a solution to solve that problem. That solution is simple, effective, single use, and reduces aerosolization of airway secretions, which will help protect our healthcare workers from patient secretions around the world. Introducing the SAMS safety seal for Guedel and bite block, brought to you by Scott Airway Management. When a patient becomes unconscious, they need a healthcare worker to breathe for them to keep them alive. This happens at the beginning of every general anesthetic, or if you become unconscious for another reason. For example, you've had a heart attack. To breathe for a patient who is unconscious, the healthcare professional must create a seal between this, a mask, and the patient's face. This allows us to create enough pressure to overcome the resistance of the airways, lungs, and chest wall and force oxygen into the patient's lungs. So facial hair prevents the seal being created between the mask and the face, and as such, it is extremely difficult or even impossible to ventilate a bearded patient. The result is insufficient oxygenation, risking a patient's life during this critical stage of an anesthetic procedure. If a patient is unconscious and the healthcare professional can't breathe for them, the patient's life may be placed at risk. The oxygen concentration in the blood will drop rapidly, starving the brain, heart, and other vital organs of what they need to survive. Healthcare professionals are currently forced to utilise unapproved methods to create a seal on a bearded patient that will get most patients through this, but it is unnecessarily stressful and dangerous. The SAMS safety seal solves this problem. Scott Airway Management has been developing this device for a number of years, working with healthcare professionals to create the design. During the in-market design validation, feedback from healthcare professionals also linked the SAMS safety seal to assisting in the reduction of aerosolization of airway secretions from patients in this and other areas of medicine like endoscopy, bronchoscopy, and transesophageal echocardiogram. It's a flexible, contoured device made of silicone. It's easy to use, single use, latex free, and TGA approved. In the COVID era, the market and the urgency for the device has increased. We know that masks and physical distancing help to reduce transmission rates of COVID-19. But when patients enter the operating theatre, neither of these measures are possible, as healthcare providers need to have direct access to the patients without a mask, and they need to be very close to them. The SAMS safety seal provides that extra layer of protection between the patient and the healthcare professional when masks and physical distancing aren't possible. This is why I invented and developed the SAMS safety seal for Guedel and bite block.